morning, everyone. I am Krishna Cansivia Flores, and today I'm going to demonstrate wound care. So let's start. So the first thing that I will be doing is to ako ipakita ninyo ang mga needed equipment. So this is my face mask, my eye protection gear, the tapes, waste receptacle, draping blanket or draping towel, the sterile dressing tray, the solution, ointment, antiseptic, and by the way, ang nasulod sa ako ang sterile tray kay koan. Sterile dressing tray kay katong sterile gauze, sterile forceps, sterile picking forceps, the sterile basin. So the next step would be check the procedure to review the procedure from the chart of the patient. Okay, I'm done checking or reviewing the order or the procedure of the patient for the patient. So next would be explain the patient the procedure. So good morning, sir. I am Prisha Cansivia Flores, your nursing assistant for today. So sir, sa karon ang mahitabo is a wound dressing or a wound critical. This is to provide comfort and also para imong samad is mas maayo o paspas. Okay, so next procedure would be drape patient's wound. Draping because you must imo ra jung ibilin is ang kana ra jung samad nga makita para dili ma-contaminate ang ubang part sa iyahang nga ga-surround sa iyahang samad nga wala joy labot sa pag-dressing. So ato i-drape iyang samad. So, gamay lang, sir. Okay, so done. So ang na-expose na lang is ang iyaharang samad. So next procedure will be see to it that all the windows, curtains, doors are closed to provide privacy to the patient. So I'm done closing all the windows, curtains, and cubicles. So let's proceed to the next step. The next step would be position the patient to its comfortable position, and then wear your protective eyewear, your mask, and then you can also wash your hands or it is needed before wearing your clean disposable gloves. And then see to it that your waste receptacle is easily reached or beside you so that when you remove the contaminated gauze from the wound, you can easily put it so that this is to provide dili ma-contaminated ang tibuok area. So, in removing the dressing, do not moisten it if it is really thickened. So, if tapot kaayo siya sa panit, do not moist it because na possibility nga ma-irritate ang samad if imong i-moisten siya. So, imo ra jud siyang hinay-hinayon og ukal parallel to the skin. Inform the patient, of course, nga nandiyo ni siya possible discomfort if kanang tapot kaayo. So, sir, ato lang kuan gamay lang sir ha, na medyo nandiyo ni siya pagkasakit if tapot yung kay ang tape. Gently remove the used gauze. Sakit, sir. And then put the used gauze from the wound in the waste receptacle and also check for the appearance of the wound. So I'm done checking. So remove your gloves and put into the waste receptacle. Next is open your sterile tray. Put solution in the kidney basin. And then apply sterile gloves. Do not touch the sterile area of the gloves. Be careful in wearing the gloves because of course you are dealing with wounds. To avoid contamination and irritation as well. It must be sterile to sterile part. Okay, so after applying, mukha ka gauze, then imo siyang bas-on sa solution nga nasa basin. Then 1 gauze per stroke. So you must clean the wound 1 stroke only from least contaminated to the most contaminated area. Least contaminated to the most contaminated, and then set aside to the waste receptacle. Next is, you can apply ointment. And then you can get a clean dry gauze, and then another layer, and then a thicker wound pad. And then you can tape it. By the way, this is for the dry dressing. Next is for the dry to wet dressing. So same as the dry dressing, you will put solution in the kidney basin, and then one stroke clean clean it in one stroke using the wet gauze. And of course, if the wound is deep, you can use wet gauze, and imo siyang isok-sok siya nga until ma-touch siya sa wound nga kanang lalom. And then after na wet na dito, imo siyang butangan og dry nga gauze. Imo siyang butangan og dry nga gauze para sa kung gihimo karon. Ako siyang botngan para ma-cover. Pero naara Japon tong moisan nga gauze sa sulod sa deep nga samad. Then kapira nimo. And that's all for the deep wounds. So the last one is remove the drape blanket. And then remove gloves. And put in the waste receptacle. Position the patient to its comfortable position. And then record the procedure and do aftercare. So that would be all. Thank you so much.